So I've just always wanted to be a midwife, maybe because I'm one of 8 children, I don't know. But I've always just loved being in that supportive role. I have a huge respect for midwives, but also for women. All the hormones that are floating around at birth, midwives get a high from the oxytocin as well, absolutely. It is really a lovely time, to be there with that mother and the new baby, and just sort of stepping back and just letting them get to know their baby, and it's an honour to be there, yeah, for sure, yeah. As the Senior Midwifery Advisor on the floor at Retrieval Services, we will take a call. Sometimes it might be a midwife and she just wants some support. It might be around breastfeeding, for instance. It might be looking at a CTG, which is a fetal heart rate trace. If you press the buzzer in those hospitals, you don't have 20 people turn up, you might have 2 or 3. I have predominantly worked in central Queensland, so I have some understanding of the tyranny of distance. Out there's not a whole bundle of people coming, but then when RFDS team turn up, they support and add to that team that's currently there.
Meredith provides a high level of support to regional centres who may not be birthing facilities, and they may be registered nurses caring for a pregnant woman, so not their specialty of area, and Meredith's able to provide that support and reassurance to the clinicians looking after the women, which then is conveyed to the women themselves.
Call came through from a registered nurse. A woman had presented, obviously in labour. Retrieval Services have telehealth cameras in Queensland Health Hospital, so we were able to actually be virtually in that room with that nurse and with that mother, and it was evident to us that the baby was about to be born. Very soon after, the woman's waters broke and a baby soon was delivered. Baby up on mum's belly, and just from me looking here in Brisbane into that hospital room, I could see that this baby was not a term baby. It wasn't a big baby, but it also had vernix, that white substance that preterm babies have. So with that in mind, got the North Queensland neonatal retrieval team on the line. Our concern was this little baby that was most likely premature. The mum was unsure of her due dates, but the baby looked about maybe 2 kilos in weight. So it was really good to be able to coordinate all of that to keep that mother and baby safe until the RFDS team came to move that mother and baby to a bigger facility. It's really important for us as Senior Midwifery Advisors to have that really current information available for the flight nurse or flight doctor. It's really rewarding to know that you can make a difference and also give the staff at those smaller hospitals confidence that they can ask for help, and help is there for them.
Thank you, Meredith, for supporting the RFDS through the great work that you do for QMID and our remote facilities. They feel more supported with you on the end of the phone, and we're comfortable flying out there knowing that they've had your support.